It helps to think of your heart as this incredible high-performance engine. And inside that engine, you've got these four critical valves that have to work like perfectly timed one-way doors. But what happens when one of the most important doors, the mitral valve, starts to break down? Well, that's exactly what we're going to get into.
So this is the big question, right? Because when we're talking about the mitral valve, its failure isn't just some small drip. Oh no. It can kick off a whole chain reaction that affects your lungs, the actual size and shape of your heart, and its fundamental ability to pump blood to your entire body. It's a huge deal.
All right, first up, let's talk about what happens when that door gets kind of jammed and just can't open all the way. This condition has a name, and it's called mitral stenosis.
So what's really going on here? Well, mitral stenosis is basically a traffic jam right in the middle of your heart. The opening has gotten way too narrow, and that makes it super difficult for blood to get from the left atrium, which is where all that fresh, oxygenated blood from the lungs collects, down into the left ventricle, the heart's main powerhouse pump.
And this is where you can really see the domino effect. A lot of the time this starts with scarring from rheumatic fever, which is a complication of strep throat. That scar tissue makes the valve leaflets thick and stiff, creating this blockage. To get blood through, the left atrium has to push so much harder, and its pressure just skyrockets. Over time, the atrium actually stretches out, it dilates, and that creates a backlog of blood that goes all the way back into the lungs, causing congestion and high blood pressure there. It gets so bad that this back pressure can even start to strain the right side of the heart, sometimes causing it to fail. It's a whole cascade.
And here's the ultimate result of that whole chain reaction. If the left ventricle isn't getting enough blood in because that door is stuck, well then it can't pump enough blood out to the rest of the body. We call that decreased cardiac output. And that's exactly why people with severe stenosis often feel so tired and out of breath. The engine just isn't getting enough fuel.
Okay, so now let's completely flip the script. What if the door isn't stuck shut, but it's actually too floppy to close properly? This brings us to our second major malfunction, and it often starts with something called mitral valve prolapse.
So just imagine the valve leaflets are like two flaps on that door. With mitral valve prolapse, or MVP, one or both of these flaps are a little too big, a little too stretchy. So when that super powerful left ventricle squeezes to pump blood out, the pressure forces the leaflets to billow backward into the left atrium. It's kind of like a parachute catching the wind, but you really don't want that happening inside your heart.
So why does this floppiness happen? Well, the main culprit is usually a condition called maximatus degeneration. Now that's just a really fancy way of saying that the connective tissue in the valve has gotten weak and stretchy. And while MVP on its own can often be pretty harmless, it's a super important piece of the puzzle because it can set the stage for a much more serious problem, a leaky valve.
Right, so you're probably thinking, a floppy valve, if it's often benign, what's the big deal? Well, here's the thing. That billowing can actually get worse and worse over time to the point where the door just can't seal shut at all. And when that happens, you get a significant leak.
And that leak is what we call mitral regurgitation. So now, every single time the left ventricle contracts to pump blood forward to the body, a bunch of that blood squirts backward through the leaky valve, right back into the left atrium. That one-way door has just become a two-way street, and that is not good.
This backward flow creates a volume overload problem. Think about it. Both the left atrium and the left ventricle now have to deal with the new blood coming in from the lungs, plus all the old blood that just leaked backward. To cope, the left ventricle gets bigger. It stretches out in a process called eccentric hypertrophy. But that's just a temporary fix. Over time, all this extra work just wears the muscle out, leading to dysfunction and eventually heart failure.
And just like we saw with the stuck valve, this backup of blood, this time because it's just too much volume, it overwhelms the left atrium and backs up into the lungs. And it leads to that exact same dangerous outcome, pulmonary hypertension. So, the end result can look really similar, but the way they get there is completely different.
So, we've covered two totally distinct failures of the exact same door. One's stuck, one's leaky. Let's put them side by side to really nail down the differences.
This table really just lays it all out perfectly. Stenosis, the stuck door, is an inflow problem. It creates a pressure overload issue, and it's often caused by rheumatic fever. On the other hand, regurgitation, the leaky door, is a backflow problem. It creates a volume overload issue, and it's commonly caused by mitral valve prolapse. And while both can lead to really serious lung and heart problems, that core mechanism, pressure versus volume, that is the crucial distinction to remember.
All right, let's zoom out for a second. Why did we spend all this time talking about one tiny valve inside the heart? What's the big picture here?
Here it is. This is the bottom line. What seems like a small mechanical issue, a door that's a little stuck or a little leaky, it doesn't just stay in one place. It creates this huge cascade of pressure and volume changes that can literally remodel the heart, damage the lungs, and ultimately lead to total system failure. It's just a powerful reminder of how every single part of this incredible engine is connected.
And that kind of leaves us with this final thought. These valve leaflets, they are unbelievably thin and delicate, yet they have to withstand incredible pressure, opening and closing over 100,000 times a day, every single day. So as we get better at understanding why they fail, the big question becomes, what's next? How can we better protect, repair, or even replace these vital and incredibly fragile structures?